Well, first of all, thank you to the organizers for inviting me. This has been an exciting meeting. I haven't been here for a number of years. I've been talking this morning about GLP-1 receptor agonists. And a few disclosures on the present major shareholders, Sensonics International, which some of you have probably seen out there. Also, some of the tests that we gave out to you are scoring keys that we failed to give you. So if you came by, we can give you the scoring keys for the web. This peptide is interesting. Most of you are probably aware of it. About 10% of the population, 10-15% of the population is taking this for weight control or weight loss. And it does notably have an effect on gastric function, motility, cravings, appetite, and so on. There's a lot of positive studies on this. This peptide was discovered, or most of the work in animals started in the 1980s, but it's been continuing at the present time. But there are positive effects on a number of things: cardiovascular disease, liver disease, imaging disease, and so on. But there are other issues that are still being studied. For example, a lot of regain of weight if you go off the medication, and indeed it may be worse than when you started. I don't know, there's just a lot of research going on there. Common agonists, common GLP agonists that you see on TV all the time or advertising are these. There are others, but these are the major ones. The clinical motivation, actually, Rafa Khan, who's my was a pre-med undergraduate at the center, had brought this to my attention. We had one patient who came in and said they seemed to have lost their taste or had a taste problem. And we were going over, usually when there's a taste problem, it's medication related. So we started looking at the medications, and indeed that's the only medication they were taking. So this made us curious about further looking at this. So we started looking in, as you know, the GLP-1 receptors are located largely in the brainstem, nucleus tractus solitarius, which is the major relay station in the taste system. It's also found in the taste buds as receptors and also in other brain regions. So when we discovered this, nobody really had looked at taste and smell function in these individuals, or people taking them. So we recruited 92 people, half of whom were taking the GLP-1 receptor agonists for some period of time. The other half had not, and they were matched on various variables, including their previous COVID history. The distribution of medications of these study participants is shown here. We used two tests. These are both self-administered, they would be sent to the mail, well validated. Many of you have heard of the Universal Multiplication Test. It's been given to millions of people now worldwide and translated to 265 languages. 65 languages. The WET is the Water Respiratory Taste Test. It's sort of an analog analogy for taste, self-administered raised dip. And this just is a little hype to this. I own the company that makes these, so you can always go buy them, or just them if you want. But it's quite accurate. We can look at norms. We have percentile norms based upon thousands of people. We can look at people up in terms of whether they have mild, moderate, severe loss, anosmia, whether they're cheating by avoiding correct answers in a force situation, and their percentile ranks and so on. The wet is similar. There's these taste strips you can move around in the mouth, and then an individual will make a decision as to whether it's sweet, sour, bitter, salty, or has no taste, or umami, coffee we call it. And there are 4 different concentrations that are presented twice of the 5 different stimuli, and then there are blanks in that, so that there's no need to rinse. And so this is sent to the mail, which doing most of our research remotely currently. And there are normative data for the web, just like they're on the absolute mass in terms of percentile rank for a given individual, given age, and so on. So in the study, we wanted to compare the wet scores and absent scores of these two groups. And we did basic analysis of variance, these individuals. We looked at data squared, and then we looked at other measures as well, statistically. But what did we find? Well, we found a pretty significant effect. We found that those that were taking a GLP-1 receptor agonist had a significantly lower score on the wet than those than the controls. That's a big effect. Data squared, the amount of variance accounted for is 37%, so it's quite remarkable. When we looked at the sub-step test scores, sweet, sour, bitter, salty, and so on, actually it showed up as a significant effect across all taste qualities. It wasn't specific to sweet taste. Interestingly, on the opposite, while there was a slight difference, it wasn't significant. So it was really affecting the taste system much more than the olfactory system. Women outperformed men on both these tests. That's well known, both of the norms. Interestingly, and this was a very interesting point, was those that did better on, that is, had less deficit from taking the medication, actually had worse side effects, diarrhea, nausea, things like that, on both the smell and taste tests. So for some reason, the larger effect was unrelated, less related to these other side effects that the medications have. Other findings, we didn't find any relationship with COVID-19 history, which we've known for a long time. Smoking behavior wasn't related to that, wasn't related to body weight, or reduced or current, or the amount of weight loss, duration of treatment, the drug dose across the different medications, or the type of medication. Interestingly, less than 25% of participants reported experiencing a drug-related decline in taste function. There's the statistics for that. 85%, however, performed below their individually matched control. So it's really, we know that in the general literature for taste and smell, people aren't very good at recognizing the degree to which they have a deficit, unless they have a real major deficit. And these data show essentially the same thing. Potential neurological basis for this, and they're just tract solitaires, as I mentioned earlier. The taste buds is found in GLP-1, is synthesized in some populations of taste bud cells. And there's also, it's throughout the brain, it's a fairly liquid, polypeptide. And limitations of our study was cross-sectional. We didn't have any BMI data for the controls. We didn't look at any genetic taste markers. And then small samples for some of the subgroups that we looked at. So that's pretty much the story, a simple study. Concluded these medications reduce perception of all 5 basic taste qualities. Smell is comparatively unaffected, with possibly some distortions, and more research obviously needs to be held with that. Side effects linked to better smell and taste test scores, possibly reflecting vagal autonomic responses. Taste loss may impact satiety, nutrition, and food enjoyment. These medications may dull food experience, not just reduce cravings. And with more than 10% of the U.S. population, these effects have major clinical and public health implications. So I want to thank the participants. This was funded by Syncytial International in terms of payments and postage and part of the tests. And a technician there, Ryan Schwartz, back with a lot of work in the organization. So I want to thank you for your attention, and I'll smell you around.
Thank you so much. We do have also questions for you. So let's start with this one.
Make it easy.
Was time they had been on the truck considered as a factor?
Yes, and we didn't see any association there. They've been on quite a long time, and we also had reports from the physicians. We had to ensure that they actually were on the medication, been on the medication, there was no relationship that we could see. So that's a very important point. The studies need to look, and they happen 2 days after you're on the medication, and they happen months after. We just don't know. There's a lot of research to be done there. This is the only study out there that I haven't ever done this.
Thank you. Would you recommend screening out those taking it when recruiting panelists?
Well, it would seem that would be a reasonable thing to do. Of course, if you really get into screening panelists, go off enough variables, you wouldn't have any panelists left. You know? But certainly, there's a big enough effect there that if you're looking at taste, it may be worth screening. On the other hand, you may want to develop groups that are on and off just to make sure that it makes no difference, because it may not affect many of the things you looked at.
Diminished perception usually is associated with higher liking. Here it doesn't look to be the case. Why?
I have no idea.
That was honest, yeah. Then the last one. How fast after administration of GLP-1 do you think the taste impairment starts, and is it reversible?
Boy, those are again questions that we don't have any data on. And some of these research on that. I'm working with people at Johns Hopkins right now where we're trying to set up some studies to look at this, but we don't know.